Today we have a fantastic set of speakers and with us from across Europe, and we are going to dive into the details with them. And our first speaker is Owen Douglas. Owen is an academic in urban planning and environmental policy, and also a town planner. And he's a PhD and a postdoctoral fellow at University College Dublin. And at the same time, he works at Eastern and Midland Regional Assembly in Ireland on policymaking and ecosystem services. And what is quite relevant for us, for our network, that Owen is one of the main authors of a research report of the Irish Environmental Protection Agency on EcoHealth, ecosystem benefits of green space for health. So now in his presentation, Owen will outline evidence-based approach to planning and designing green space for health and well-being across the life course. So Owen, over to you. We look forward to have your thoughts.
Thank you very much, Thomas, and thank you for the invitation to speak to the Health and Green Space Network today, and thank you to Urbact and the team for organizing everything. I think it's gone pretty smoothly so far. So I'll just, to avoid any technical problems, I'll share my screen first and move on from that.
Really?
All right, can everybody see my screen okay? Yeah. Great. So yeah, thanks again for the introduction. So in this talk today, I'll be applying evidence-informed planning research, as outlined by Thomas, to propose the adoption of a green infrastructure planning approach as a means to enhance population health and well-being in cities. So what I'm doing is taking research findings and applying them to practical planning, and hopefully with positive health and well-being outcomes. And I was thinking about where to start, and I thought it would be useful to start at the beginning, and to say that green space in cities isn't a new idea. And going back before that, urban planning and public health systems in our modern cities actually share the same roots. You'll see the image here on the left is a representation of an 18th century city scene. In the 18th and 19th century, during the Industrial Revolution, large populations moved into cities across Europe and the world more broadly, resulting in overcrowding. Industry was co-located with these settlements, resulting in poor air quality, poor water quality from pollution, and there were serious issues with infectious diseases such as cholera, typhoid. So it was this that resulted in the development of public health systems and engineering and sanitation as we know it, and also urban planning. In the 19th century, a key movement in the context of green space was the public parks movement, and the whole idea here was it was a desire to improve health in the overcrowded conditions of rapidly growing industrial cities. So at that time, we didn't have the scientific knowledge to show statistical associations between exposure to green space and positive health outcomes, but there was an intuitive understanding that this was something that was important. And at that time, green space was considered as important in city development as, say, a proper drainage scheme. The green spaces that existed were referred to as the lungs of the city or the lungs of the town. Clear health implications here. And the focus was, at the time, in terms of planning, was about increasing the number of open spaces, however small, in urban areas. So there was this innate understanding. Just briefly, the image on the right is an aerial image of St. Stephen's Green, which is a typical 19th century park in my city in Dublin. It shows greenery, paths, and a pond surrounded by buildings. This was first developed as a pleasure garden for the residents of who lived around the park. It was private, but given the new understanding that it could be helpful for the health and well-being of the population, it was opened up to the public. So I think it's important to give this historical overview. Nowadays, we have scientific knowledge, and I'm not going to go in depth into studies, but I think it's clear now that we have clear benefits from green space in terms of our health. It promotes our physical activity by creating spaces for play, recreation, walking, and cycling within a safe environment. It enhances our mental well-being by creating urban refuges. And I think some of the first speakers in the first Academy session would have dealt with some of these issues. To provide a restorative environment through increased contact with nature. Green spaces provide locations to enhance our social interactions. They provide the opportunity for social contacts and for community building. Then also green space have other functions too. They reduce environmental risks from pollution. They mitigate air pollution through the absorption of CO2. There's also carbon sequestration that's undertaken, and also noise pollution. The research shows that even blocking off a view of a road or a noise source with greenery reduces the perceived exposure to noise in populations, so resulting in positive mental health benefits. Green space also mitigates environmental risks from extreme weather, such as urban flooding and the urban heat island effect. So obviously it plays a role in terms of dealing with climate change and other related outcomes. So in the 21st century, we have an approach for city development, which is sort of loosely based around the compact city idea. That is, we've moved towards a morphology of integrated land use, and there are real strengths to this. We have reduced need to travel by car. It's more viable for public transport and walking and cycling. And these are, as we've discussed at the outset there, key aspects of the healthy city that some of the other speakers will address in more detail. And also the revitalization and regeneration of inner urban areas. Former industrial areas are being redeveloped in our cities. And it's our choice now, our decisions are being made on how they should be redeveloped. And also the prevention of urban sprawl, which is also an important issue. Along with these great benefits, there are some threats associated with this approach to planning. Of course, green space integration into the compact city can be a key element. However, existing vacant land and green spaces are put under pressure for development under this model. Urban densification relies heavily on traditional forms of hard infrastructure, such as underground piped drainage and intensive land use. And this does pose a threat to green space provision. We can't assume that for decision makers in our cities that the provision of green space will be a priority necessarily, a policy priority. So the weaknesses that I outlined do render the compact city model exposed to being less adaptable in terms of our changing biophysical conditions and in the context of climate change and global warming. Then on the health side, in our cities in the 21st century, as much as integrated land use is good and it helps provide better locations for walking and cycling and taking public transport, we also have developed more sedentary lifestyles. And as Tomas mentioned at the outset, the importance of likes of green space in the context of COVID-19, we're living more sedentary lives now. We order food in, we do different things like this. So it's important for our cities to respond to the reality of modern lifestyles. Our cities have been described as obesogenic and psychologically damaging in terms of their environments, resulting in widespread what are referred to as lifestyle illnesses. So things like obesity and then associated medical conditions such as diabetes, heart disease, various types of cancer, and even negative mental health outcomes. So in a way, taken together, this and the last slide pose real challenges for planning. And what I'm proposing, and as I will outline as I continue a rationale for, is a green infrastructure approach in our city planning. Just one sec. I just want to read the definition, and my screens are covering it here. So green infrastructure, it's defined by the European Commission, and I didn't want to get it wrong, is a strategically planned network of natural and semi-natural areas with other environmental features. It is designed and managed to deliver a wide range of ecosystem services. And that's an important terminology here, ecosystem services. These are the services provided by nature and the natural environment to human beings. These include in the city, water purification, in general, water purification, air quality, space for recreation, and climate mitigation and adaptation interventions. The green infrastructure network that we create, it's a network of green and blue spaces, comprising land and water, can improve environmental conditions and therefore citizens' health and quality of life. So it's not just a matter of beautification or making our cities pretty. This green infrastructure provides real services to society, to the economy. It also supports, as I say, it also supports green economy, creates job opportunities, and enhances biodiversity. So in this way, we can say that green infrastructure is in fact a multifunctional asset within our cities. On this basis, then, there is an approach to planning referred to as the green infrastructure planning approach. And this provides a perspective or a philosophy of planning that can help mainstream the health-related issues associated with green space planning through a focus on enhancing the mutually beneficial interactions between ecosystems and society. So what I've spoken about before is it's conceptual at one level, and it's easy to sort of accept it. But I think it's important to break down green infrastructure into its parts and to propose here the green infrastructure framework and to outline here the green infrastructure framework. So within this network of green spaces, we have hubs. These are ecologically important large natural areas. Maybe not all cities have these. They might include wetlands, woodlands, but also large urban parks. Then we have parcels. These are smaller units important in urban areas. And say the 19th century park that I showed an image of earlier could be considered a parcel in its own right. Then we have individual features at local levels. These are smaller elements. These might be private gardens, greener living roofs, planters, incidental green elements. And then key to the green infrastructure network and green infrastructure planning is the idea of corridors. And these are the important elements as well for walking and cycling that we'll tie into later on. Green infrastructure corridors provide networking function to link hubs, parcels, and elements. These can be solid corridors, such as greenways and blueways, but they can also, where it's not possible to have a solid green corridor in a city, we can also have stepping stone corridors, and these might be just the improvement of the provision of, say, urban street trees, planters, the general greening of our streets. And then at the end, we have land use buffers. So these are at the outside. It might be the coastal area, transition areas to our suburbs. These networks can be referred to as ecological networks or green and blue infrastructure networks, GBI, and they can be at multiple scales. So on this slide here, the top left is the national ecological network for the nation of Lithuania. At the bottom left is the famous Five Fingers of Copenhagen, which is a regional ecological network. And in the center is a green infrastructure network, that schematic for a local area in Dublin referred to as the Naas Road Lands Local Area Plan. So what it does, if we look at the image in the center, is that there are existing parcels. We have existing parks, we have a canal, we have a cemetery, and what happens here is there's retrofitting done to connect these together into a green infrastructure network. Um, and and this location would have been largely industrial. It's a transition zone between industry and suburbia, and it's an example of how we can use green infrastructure to create these networks, which can be usable as well for walking and cycling. We're still at quite a conceptual high level when we're talking like this. So how can we enhance people's use of green space for health and well-being? How do we actually program or plan these green spaces on a case-by-case level? That's a question that, as part of the team on the EcoHealth project that Tomas mentioned at the outset, I was involved in answering. In this project, which was undertaken at University College Dublin, but I would say it's significant because it was funded jointly by the Irish Environmental Protection Agency, but also the organisation responsible for health, the Health Service Executive. So it was a co-funded project, which clearly recognised the need to bring together green space and health sort of authorities as a way of funding research and understanding this better. So what we did in this project was we explored the health benefits of ecosystem services as a method to supply evidence and tools for developing health promoting environments, or what we refer to as healthy places. From the outset, it's important to recognize that urban planning as it exists now does have its limitations. Planning approaches often focus on the quantity or the quantum or the amount of green space provided, and maybe its accessibility. But in many ways, existing structures in policy and local development don't consider wider considerations such as the quality of that green space, the types of users that use the green space, the environmental context of green spaces. Should green spaces in the urban core necessarily be the same as a green space in a suburb or in a rural town or village? What are how can we use these green spaces to promote health? And then what are the appropriate design strategies and programming for these spaces? So these are key questions. In starting this project, we needed to know what the evidence showed already, and we found that it was largely in the medical literature, in medical journals, where research has been done to look at associations between exposure and use of green space and specific health outcomes. And this was a large literature, so it was our responsibility to find a way to distill this medical knowledge down to a way that could speak to the planning profession and speak to the language of planning. So we formulated a life course perspective. So much of the literature dealt with a specific cohort. So the association between, say, cognitive impairment in children and exposure to and proximity to green space. These sort of very specific associations. So what we did was we tried to bring it together. And within this, we identified cohort-specific and cross-cutting design interventions to propose an integrated green space framework for health and well-being. This work we had published in Cities, which is a prestigious international journal. It's the International Journal of Urban Policy and Planning. And it was published in 2017. And since then, it still ranks among the top 20 cited papers within that journal. So the framework we've proposed, we hope, is useful and has been considered useful. I'm not going to go through these slides in detail, but this is an example of how we looked at the issues associated with health and green space in adolescents or in teenagers. We identified the literature that found associations, and then we developed or interpreted green space interventions which would act to promote health among teenagers as a result of green space use and accessibility. And then in the end, We brought together all of the knowledge that we developed for each of the cohorts to create an integrated framework for health and well-being. So in the column on the far right are universally cross-cutting interventions for planning and design and management that will seem to be common across the age cohorts. And then in the first column, then you see these are maybe cohort-specific interventions. So I'll just read the first column is provide formal facilities for vigorous activities such as sports courts, all-weather pitches, outdoor gymnasiums, and skate parks. So this intervention is relevant for children, for teenagers, and for adults, but less so maybe for those in later life or for pregnant women, for instance, at certain stages. So it's just important to see that some interventions will be more suitable for certain cohorts, and we need to create a balance in the design and development of our green spaces as a result. So this review that I've discussed was only at the first step in this large project, which I'm not going to, it's a medium-sized project, but we did a lot of work, and it was in the first step. We also undertook qualitative in-depth interviews with key informants. We ran a quantitative household survey and choice experiments, and did participatory design workshops with local citizens in different types of locations as well, in urban areas, in suburban areas, and in the rural context. And as a result, we've come up with a series of cross-cutting design principles, which are kind of key takeaways from today, I think, in terms of what our research has shown, and it's tied very much with the green infrastructure approach to planning. So what should these networks and green spaces look like in our cities? Well, what we found is that they should be accessible spaces with good links, again, the pedestrian and cycleways, to nearby neighborhoods. A key thing, and tying in with the green infrastructure approach, is the need for a networked approach, emphasizing connections, connecting green spaces and new and existing green spaces with each other, and creating links between urban and rural areas. And just the points below outline some of the ways we can do that. Our design needs to be responsive to our populations and inclusive. So while the review I outlined showed the need to be responsive to different age groups, we also need to be responsive to socioeconomic environments as well. We need to cater for local needs from young to old, and all physical abilities. One idea that's out there is the idea of the 8 to 80 park. And the idea of the 8 to 80 park is that if you design a park for an 8-year-old and an 80-year-old, you bring them together into a room and design a park, you thereby design a park for everybody, or a green space for everybody. We argue that green spaces that are designed to support very specific functions tend to attract limited groups of users, such as playing fields, for instance. Green spaces should be intelligently well managed and maintained to create a high quality environment. Clearly, and it's obvious, the poorly managed spaces or vandalism prompt negative perceptions among potential users. You know, the health and green space association won't occur if green spaces are considered to be dangerous or vandalized, etc. They need to be multifunctional. We need to have spaces that encourage multiple functions. Examples include spaces that encourage active mobility, physical activity and sports, but also, and at the same time, relaxation and tranquility, and opportunities for social exchange. We can enhance our greening through planting strategies that act to mitigate noise and air pollution, and maximize local biodiversity gain and facilitate sustainable drainage. So clever planting, you know, pollinator-friendly planting, screening where appropriate. And we need to create multisensory restorative environments that help mitigate psychological stress. So again, I'm plugging this this report that Tomas mentioned. So this is the EcoHealth report. In in this report, what's key is that we promote green space as a public health infrastructure, a key public health infrastructure. We argue that health promotion needs to be integrated with green space management. From a planning policy perspective, we recommend the integration of health impact assessment with strategic environmental assessment, and we recommend that this should take place at the screening stage. We recommend a green infrastructure approach for green space provision, not just providing individual parcels and plots. It needs to be networked and multi-scalar, linking together, and we need to retrofit our cities where possible. And wherever possible, we should co-design spaces with end users. Ultimately, those that are going to use the spaces should be involved in their design. Our findings are recognized broadly and are aligned with what is recognized in policy currently, from global to national, regional, and local. There is increased recognition of the role of green space for enhancing health and well-being. What's less clear are the points that I've been speaking about in terms of the specific design interventions required. So we have the Sustainable Development Goals, the European Green Deal, and then from the UN we have the new Urban Agenda. And there's a recent document that they published. It's a source book for integrating health in urban and territorial planning. Within that document, they don't use green infrastructure as a model, which I actually feel is a bit of a shortcoming. We see increasingly recognition for, in addition to the economic, we have better understanding now of the social and environmental determinants for health or of health. And in Ireland, through the Healthy Ireland framework, which our project was actually funded to inform, we have a health in all policies approach. So Healthy Ireland is a cross-government framework whereby all government departments signed this framework, recognizing that health cross-cuts all sectoral areas. And I would close really in this argument by saying that green space is an essential urban infrastructure for healthy cities. And finally, I'd just like to outline some of the current work that I'm doing at the Eastern and Midland Regional Assembly. I'm working on the Progress project, which is an Interreg Europe project. And we're working with 5 other regional partner organizations to design, enhance, and implement policies which protect and value biodiversity and ecosystem services. So that which I've been speaking about. The project recognizes that multiple functions of ecosystems beyond biodiversity exist, extending to social and economic benefits if managed in a sustainable and intelligent fashion. And this is in the city as well. And what we're doing is we're creating a policy framework in our participating regions, which establishes a more central role for ecosystem services in providing solutions for regional development, which are sustainable and actionable. So, for example, in the case of our region, we have our regional spatial and economic strategy, which integrates ideas of ecosystem services and green infrastructure. But what the project is trying to do is draw on the likes of the kind of argument I was making before to identify practical practices for the implementation of these solutions. So thank you very much. These are my contact details and the Twitter handles and websites for the various projects mentioned in my presentation. Thank you very much.